and welcome. I'm Tafaragadamu. Another experience in fighting COVID-19. This time it is from Cuba. How are the Cubans trying to address the pandemic? My guest today, Ambassador Vilma Thomas of Cuba, joins me to talk about what they are doing in her country, from testing to treatment to the production of drugs, as well as supporting other countries by sending medical personnel. A very warm welcome to the program, Ambassador Thomas.
Thank you very much.
So how's it going in Cuba?
Well, we are also facing coronavirus like everybody else. And right now we have 79 deaths in Cuba.
Yeah, since it was first detected in the second week of March.
In March, yes. In March 11, the three first cases from Italy. It was imported, of course. And up to now, we have unfortunately, 79 deaths. But also we have 1,505 people recovered.
So how many active cases do we have now?
Now we have only 268 active cases. From then, 260 are in a stable situation. That's the last stat we have until yesterday.
You are in a better position as far as the countries in Latin America and the Caribbean are concerned, right? A much better position.
Yes, I think we are. We have actually a lower death rate than many of the countries in our regions. And also we are very hopeful because in the last 6 days nobody has died. And the numbers are indicating that the situation is going to a better place than before.
So what is the reason behind all this? I mean, I would, you can call it a success story in a way, to keep the infection rate at that level, the number of the day at that level, and actually decreasing and no case so far in the last. I mean, no cases reported in the last 6 days.
In the last 6 days, no deaths. Yes.
No death. So that is a pretty great story. I mean, how did you manage to do that? I mean, I know that you introduced massive testing, right?
We are testing a lot. Actually, we are testing a lot. We start testing first the people at major risk when the epidemic was first discovered. And then now we have testing not only them, but also their contacts, the people who may be in a situation of risk, especially elderly people, that have, let's say, a situation in disadvantage regarding the coronavirus. And then now we are going for testing communities at large. Because at the beginning, as I say, we were just trying to identify people who may be having coronavirus. And now we are looking for coronavirus, wherever it is, in our communities, in our neighborhoods, in places where there must be more people at risk. That's what we are doing now.
How do you identify the locations where most people are at risk?
Well, because, we have, in Cuba, we have the system of the family physician, we call a nurse. It means you have a physician for every 120 families in Cuba, in the community.
So the ratio is 9 doctors to 1,000?
9 doctors to 1,000 in the country. We have, in Cuba, around 100,000 doctors. And then they are looking in a door-to-door screening process that is done in Cuba on daily basis.
Not on one-time visit?
Not on one-time visit, no. They go daily basis because, of course, with the system we have, it is possible. And also we have included students of medicine in the country who are also part of this door-to-door screening. So they go on daily basis to each and every household in the country. No matter if you are in the city or even in the rural areas.
Everybody is covered.
Everybody is covered, 100% coverage. And then they try to identify if there is anybody who is having any symptoms, any indications that may be reason for concern. And if that person, it is identified with any of the symptoms, that person is taken. It is given what we call a rapid test in order to try to detect. And if the physician advised, then they will go for a PCR test, which is a more elaborated one. And we identify if that person is being found positive, then study and search is going through all the family and the person who may be in contact, and those people are put in isolation. And from then on, all the process starts.
So you've been doing this on a daily basis, the mandatory...
Screening
this every day for the last how many months?
And since this situation started in March, because of course this is an effort that is not only government or Ministry of Health. It is a people's effort too. So
people look forward to it?
People look forward to it. Actually, there are a lot of stories you will find in prison, social media, some kind of relation established, and especially elderly people who look forward to the visit of the people who do the screening. They know him or her, especially the young people, from his name. They don't go into the houses. They do the screening from outside the houses. But there's a relation established because it's someone who will be there every day trying to find out about your health and making sure you are right, or if you don't, you get the proper attention and care as soon as possible in order to prevent the deterioration of your health.
And also you've cut, foreign travel to Cuba, right?
Yes, we have.
You already...
It was a tough measure for Cuba, because Cuba tourism is very important for our economy. We have to do it. On March 31st, decision was taken to stop any commercial flight coming to Cuba, and vessels that were in Cuban territorial waters were requested to leave. And it was a very tough decision from the economic point of view, but it also reflects the priority we give to health of the people. So despite being very tough on the country, and even the Cubans, we knew from the beginning that that measure will be taken, and that is going to be our life a little bit more difficult. But it is interesting. The people wanted that measure to be taken.
Really?
The people do wanted that measure to be taken because everybody knows where the priority is. And at that time, at least, life is your priority, nor economic or finances.
Let's get back to testing thing. How are you handling this with the embargo, with the US embargo? Because you cannot import medicines, you cannot import testing equipment, you cannot buy stuff from abroad and all that. How was it possible to handle for you testing in Cuba? Because you have to have quite a supply.
Well, for us it has been difficult, really, to face this pandemic. It has been difficult for the whole world, but in the case of Cuba, we have an aggravated circumstances, and it is that Cuba is under U.S. blockade for close to 60 years now. And of course, it prevents us to access to medicines and equipments and anything we need. And just to give you a figure, only last year, just for a year, the impact of the blockade in health in Cuba was around 104 millions, only for health. So when a situation like this arrives into a country who is under such strict sanctions, who have been increased by the Trump administration, it put really a lot of stress in the economy and the finances, and in the living of the people. And the only way, it has been tough. I'm not underestimating the impact. It has been tough. We have not been able to access to many of the medicines some people have. We have been preventing even one of the companies that was supposed to be sending ventilators to Cuba was bought by a U.S. company, and then because of the blockade, they decided they will not send ventilators. Even the donation of Jack Ma, Alibaba, that was arriving to many countries, including Ethiopia, and was also sent to some of the countries in Latin America, was not able to arrive in Cuba because of the company that was supposed to transport refused to do for fears of being subject to blockade. Some of the protection equipment, so all those things that are usually available to countries to be able to face the pandemic, unfortunately were not being given or being made accessible to Cubans. But we have some inner strength, I would say, to face the pandemic. The first one is our health system, For the 61 years of the revolution, priority was given to develop a health system that which we are proud of, that is exemplary. We have a lot of professionals in health, a lot of health institutions, and a lot of development on this one. And I think the other one is our scientific community. Cuba started developing biotechnology at the moment when we were going through what we call a special period, a very tough a moment for us from the economic point of view. And that investment in biotechnology and that priority given to the science development has paid off now, because the biotechnology industry has been working alongside health institutions to try to find medicines, treatment, drugs to face coronavirus.
Wow. You've tested that already, I know.
Yes.
One of the drugs.
We are doing even one of our drugs, the interferon alpha 2B, is part of protocol to treat coronavirus in close to 40 countries, and also in Cuba.
Has it been cleared by the WHO?
It's been used, and the WHO is part of the treatment has been approved to be used in some of the countries, and even it was used in China, where this situation appeared first with good results, and it's part of the protocol in many countries. And also some other drugs produced in Cuba has been used to treat. I wanted to be sure. It doesn't mean we have the cure or the vaccine, because nobody has. No. But it means that we have drugs and medicines that can be used to treat patients. And even some of them can be used to boost the immune system of people. So even if you get coronavirus, it will not develop into the critical situation. And the third thing I think it is important, and it may answer your question, is the priority given to the government, by the government to this. This is an effort that is being led by the government alongside the scientific, the medical community, and with the participation of people. The government is following up every day, and the community are totally and directly involved in the process, and also they have a voice in the decision making. So it's a country effort. That's the only way to face coronavirus when you have the disadvantage of being under sanctions that are trying to asphyxiate your people.
So what you're saying is you're producing your own goods and your own equipment to be able to handle this, particularly the testing one, which you think is very critical in locating people who've...
Yes, that's the way.
The Cuban healthcare system is as robust as it used to be because it's got tested in this epidemic. That's what you're saying, right?
Yes, I think it is. Also, is first of all, it's a health system. Second, the health professionals that are well-trained and, they are professionally recognized all over the world. Also, we have to say that another advantage we have is that our health professionals have participated in rescue missions, in help missions in many countries, in the case of disaster situation, in the case of epidemics, like in the case of Ebola in Africa.
And that's what you're doing now, right? You've dispatched quite a number of them, over 1,400 medical professionals, doctors, nurses, to many countries.
To many countries, 26 countries actually. They are also helping now, including Italy in Europe and Andorra. And also,
where you first got your case.
Yes, but we are helping because it was requested. And also, of course, they are helping in Africa, in Latin America, in the Middle East, in the case of Qatar. But what this is because we think, and this is the opinion of the Cuban government, that coronavirus put the world into a position where we should cooperate. We should try to help one another despite any differences, because we are on all this together. And it has been said by Cuba, but as usually, Cuba is not only saying, but is also leading by example. And that's why even when we have coronavirus at home and we are dealing with it under the circumstances I have explained to you, we are also supporting and helping others to face coronavirus with our doctors, with the medicines and drugs we have been able to use in Cuba, and also helping anyone who may need us, like was the case of the British cruise that was, in the Caribbean, and nobody wanted to open the doors
to dock, and you eventually did it on the shore in Cuba, right?
Yes, they docked in Cuba, and they were received. They were taken to the flights, and they were sent back home. because it will not be, appropriate for us to be preaching solidarity and not showing solidarity, and also because we trust the strength of our medical system and the preparation that people have to handle situations like this, because it has been tasted in so many difficult situations that it was one more.
So there were cases inside that ship, right?
They were
positive guys, but nonetheless you
That's
you
why-
allowed
that
them
wa- that's
because
why
many
many
in the
people-
Caribbean refused.
That's why
to
many
dock.
people refuse. But we say yes, and I think it was a humanitarian action on the Cuban side. And then we received them and even offer to treat those patients with coronavirus if they wanted to. That has been the position of Cuba all over, to lend a hand, to promote and practice solidarity whenever it is needed, despite this effort being sabotaged in a way or criticized or slandered by the U.S. Administration, who has been accusing Cuba and Cuban doctors all over the world and trying to ask countries not to request support from Cuba as part of the vendetta.
Four of the Latin American countries.
Yeah, they are doing but not only from Latin American countries. They are doing all over the world. They succeed in Latin America in some countries, like it was the case of Brazil. They succeed in Brazil and Bolivia and some countries. But of course, in those
they told the Cuban doctors to leave the country.
To leave the country, yes. And unfortunately, in those countries who told the Cuban doctors to leave, the Cuban doctors who were given attention to the poorest community, to the disadvantaged people, now they are unfortunately in a very bad situation. You see in the media the figures that Brazil is presenting and also the situation in Ecuador, unfortunately. But fortunately, many other countries did not follow then, and now we have 26 Cuban teams, especially for coronavirus, in 24 countries. And also we have Cuban teams in 59 other countries, also supporting the local authorities to face the pandemic.
So you offer the services of Cuban medical professionals to those countries, or they request help from Cuba? How does it?
No. They request help from Cuba, and Cuba answered that request within our possibilities. Because of course we have to give priority to solve and to guarantee the health care of our people. But also it has been a practice with Cuba. We don't give what we have in excess. We share what we have. And that's what we are doing. Maybe somebody needs 100 doctors and we can only give 50, but at least we are sharing and we are helping.
So what exactly do they do in those 22 countries? Are they are deployed on the ground, helping the people survive, or give advice, or help in research? What exactly do they do?
It's a little bit of all. They are deployed in the grounds. Actually, in some places, they have been deployed into the provinces, into the areas where people have less access to health. They are also helping when they are requested, in strategies to help governments or health authorities in the countries to develop strategies. We are also we are sharing our experiences in coronavirus, even not only through the doctors on the ground, but also using technology. And we have do video conference with countries who have requested to be part in order to explain our experiences. We are not giving any recipe. Each country is different. And we respect the decision of every country how to handle the pandemic. But what we are doing is sharing our experiences. And we hope that at least some of them can be useful for the strategies of those countries.
Ethiopia hasn't put the request forward to Cuba, right? Ethiopia hasn't requested Cuba's help in this.
No, Ethiopia has not required Cuba help doctors to help the pandemic, but we have doctors in Ethiopia already.
There are plenty here, several medical doctors.
There are doctors in Ethiopia, Cuban doctors in Ethiopia already, also helping the Ethiopian authorities. And also Ethiopia was part of one of those video conferences with Cuban experts on the way of handling the pandemic. Because this also, sharing of experience is also a sort of cooperation. And also we have it with Ethiopia and with the African Union, here in Addis Ababa. As I say, we have a lot of doctors all over, including in Africa. Africa is a continent very close to Cuba, and that's why some people may wonder why I'm wearing this turban, African style.
There is nothing Cuban in that.
Well, in Cuba, there is a lot of Africa in Cuba, I have to say. But because we are very close to Africa Day, I decided just to follow something we have been calling from Cuba the African Challenge. We wanted to celebrate Africa Day because not even coronavirus will stop us from celebrating Africa Day. And we have called for this challenge for everybody to wear something Africa, to pay homage to this continent that is very close and very dear to us.
So do you think that the coronavirus would make a dramatic comeback in Cuba, or it has a slim chance, what they call the second wave?
Well, I would like to say that I stay positive, and I think that taking into account the number of cases we have, the measures that are put in place, and the commitment of the government to safeguard in the first place the health of the people, even if it means sacrifices economically, alongside with the research from our medical community has proven effective. We may have been in a position to advance toward better scenarios and not towards worse. Of course, it all depends on the behavior of our people. If we keep on acting like we are acting now, if we keep on following measures implemented, keep on social distancing, do a step-by-step opening when the times arise and everything, I think we have a good chance to at least not to go back on the success that we already have.
And one of them is a TV show that the chief epidemiologist in your Ministry of Health makes, connects with people, right?
Yeah, I was telling you before that every day in Cuba, 9 a.m., all the Cubans, wherever you are, even if you are in the country or you are outside, you do it through social media. We are following a TV program by the head epidemiologist of the Ministry of Health, Dr. Duran. It's very popular in Cuba, where he's explaining the pandemic, how it is behaving in Cuba, how many cases we have, if unfortunately we have we have some death, how many people are in critical position, how the situation is, the people who are affected from which community, give advices of what to do or what not to do to people, how the situation in Cuba compared to Latin America and to the world, who has made almost all the Cuban a little bit of expert in coronavirus and coronavirus handling. And it's been good because it's an education of the people on the pandemic, and at the same time of a way of increasing prevention to try to stop any further spread.
Wow, that's quite an innovation. Well, thank you very much, Ambassador Thomas, for joining me here.
Pleasure is all mine.
Thank you very much.